Welcome to the Logic Series Video Tutorial Getting Started Guide. These video clips will help you in setting up your system for first-time use. In this section, we'll cover scanning mode functionality. B-mode gain increases and decreases the amount of echo information displayed on an image. Adjusting gain values varies depending on the probe. Note, all imaging modes have an independent master gain. B-mode gain is independent of M-mode, pulse wave Doppler, and, of course, color Doppler. Changing the pulse wave gain while in pulse does not affect the B-mode image gain. To increase and decrease, simply rotate the gain knobs. While in color Doppler, the region of interest, or ROI, can be adjusted using the north trackball key when selecting an area of interest in color flow. You can slant the region of interest of the color flow box left or right to get optimal Doppler angles for better color imaging. The angle steer function only applies to linear probes. To adjust the slant of a linear image, left or right, adjust the angle steer, which is the toggle underneath the touchscreen. Linear probes can be steered left 20 degrees, center or right 20 degrees in 5-degree increments. Adjust the velocity scale to accommodate faster or slower blood flow velocities. Velocity scale determines the pulse repetition frequency. Color invert or Doppler invert lets you view blood flow from a different perspective. For example, red away negative velocities and blue toward positive velocities. You can invert in real time or on a frozen image. Invert reverses the color map, not the color scale. Note, in pulse wave, both color flow and Doppler mode velocity scales invert. You can invert independently by changing in Utilities. Select Utilities, System, then System Imaging, and then turn off the color Doppler link. Save and exit. This allows you to view blood flow according to your personal preference without flipping the probe. Flow model shortcut values vary by application. Selecting flow model shortcuts will automatically optimize many color flow technologies with the press of a button. The system will allow you to activate different frequencies for better penetration and color sensitivity separate from your B-mode frequency changes. The system can also be adjusted to set auto frequency, which will change frequencies as you change your region of interest in the near field or far field, setting higher frequencies for superficial structures, lower frequencies for structures at depth. Sample volume affects the axial resolution of the color display. Wall filter is located on the color flow touch panel on the right-hand side above the frequency settings. You can reduce the wall filter to 0 and raised to a level of 3, filtering out wall motion artifact potentially. Wall filter filters out low flow velocity signals. It may get rid of motion artifact caused by breathing or other patient motion. In pulse wave, wall filter eliminates slow flow as well as artifacts caused by breathing or other patient motion. Wall filter functions in color flow and pulse wave is the same, although the values may be different. Colorize is the colorization of the conventional B-mode image or Doppler spectrum to enhance the user's ability to discern B-mode, M-mode, or pulse wave mode intensity variations. Colorize is not a Doppler mode. Colorize the grayscale image to enhance the eye's discrimination capabilities. Spectral colorize colorizes the spectrum as a function of power using the inverse of the color maps for the signal intensity in each Doppler line. Colorize enhances the visibility of the spectrum's characteristics and enhances your ability to identify spectral broadening and the edge contour of the spectrum used to define the peak frequency or velocity. To deselect the colorized map, simply select a new gray map. Power Doppler imaging, or PDI, is a color flow mapping technique used to map the strength of the Doppler signal coming from the flow rather than from the frequency shift of the signal. Using this technique, the ultrasound system plots color flow based on the number of reflectors that are moving regardless of their velocity. PDI does not map velocity. Therefore, it is not subject to aliasing. The color flow appears over the B-mode image. Move the trackball to move the color flow window. Display the MD mode cursor on the B-mode image with the left trackball key while in B-mode Doppler imaging. A mode cursor will display on your screen. Trackball to position the MD mode cursor and select the angle and sample volume length as necessary. Benefits. This lets you position the MD mode cursor before you go into M mode or pulse wave Doppler, so you make optimal use of the large B-mode image. Thanks for visiting the Logic Club video tutorials. Please come back soon for more tips on how to use your Logic system.